want to go back to the other view.
Are we live now?
Alrighty.
Yes, we're live.
Okay, we'll get started. Good afternoon, everybody. This is Thursday, September 16th, 2021 board meeting. Just like to remind everybody that this is being recorded by video and audio. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting can do so via Zoom video conferencing. The video conference will be shown on Nantucket's government TV YouTube page, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket government TV YouTube live feed for the meeting. People registering must attend as attendees must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click and raise the hand button if they wish to speak. The chair will call on those who have raised their hands in order they are raised. If you do not have an audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions that cannot be verbally asked must use the Q&A function. All questions should be directed through the chair. And for attendance purposes, can you acknowledge that you are here? As I see you, we'll go with board members first. Malcolm McNabb.
Present.
Meredith Lepre.
Here.
Jim Cooper.
Here.
Thanks. And we'll start with staff. Roberto Santa Maria.
Here.
Kathy Flynn.
Present.
John Hedden.
Here.
Kathy LeCave.
Present.
And I think we also have a Don Bracken joining in later.
Here now.
Okay. Is there anything that anybody wants to talk about that's not on the agenda as I see this? No? Okay. We'll start with approval of the minutes from August 12th, 19th, 2021. Does anybody have any revisions or corrections? Okay, seeing okay, approval of the minutes.
So moved.
A second. All okay by roll call vote. Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
Jim Cooper,
Yes.
and Steve Visco says yes. Okay. Recommendations and compliance documents. Reference for 115 Surfside Road. No operation and maintenance agreement.
Correct. So this one's an odd situation. So when we passed Regulation 65, a significant time ago now, oddly enough, we didn't put in an enforcement clause. So we can't just throw in tickets as needed. So what has happened is, and we've never had an O&M agreement go this far either, group without an O&M. So we actually need a vote from the board to give us the authority to start fining. The idea that we're using is to use non-criminal disposition based on the other regulation that we have, the special regulation, the special ordinances section, so that we can apply Chapter 21D. So what I need is from a vote from the board saying that you authorize us to fine 115 Surfside at up to $300 per day, according to Chapter 21D.
Is this going to be a one-time thing once we vote right now, or could somebody else come in front of us?
You can, for this one, I need the vote so that we can continue, and then I'm going to have to fix the regulation. So we'll have to have a public hearing probably in November so that this doesn't happen again.
A motion from the board to give staff permission to fine this person as as needed to get to come into compliance?
So moved as stated by Roberto.
Second.
Okay, all in favor by roll call vote? Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
Jim Cooper,
Yes.
and Steve Visco says yes. Okay. Okay, variance request for 11 D Street.
Yes, so this is a septic system repair and an upgrade. It is a maximum feasible compliance situation. There is a letter of objection from a resident of Nantucket. However, in this sort of situation, because it is maximum feasible compliance and because they are also connecting to town water, I believe, Don, correct me if I'm wrong, staff has no objection with offering this variance, with agreeing with this variance. This is actually one of the types of variances that Artel brought up at the last meeting that we used to be able to do in-house, but we never found the vote in in one of the minutes that actually codified that for us. So we're bringing this up to the board now, and then we'll be bringing a policy in front of you next meeting so that we can actually codify it, so that we don't need to have Don here and we don't have to get all these variances in front of the board each time. But we have no objections to this variance.
Does anybody have any questions for John on the variances or the property in general? No. So, I mean, they are hooked into town water, and just to let everybody know this, previously to there was a septic and well installed on that property. They had a certificate of compliance, so.
Correct.
Board to accept the variances as written.
I make a motion to accept.
Second.
Okay, all in favor by roll call vote, Malcolm McNabb,
Yes.
Jim Cooper,
Yes.
Meredith Lepre,
Yes.
and Steve Visco says yes.
Thank you.
Thanks, Don. Okay, what next? Variance request for 2 Tennessee Ave, setbacks, local board of health reg 5102 A and B.
This is a very similar situation. It's another maximum feasible compliance situation. Town does not have any objections, but I'll also let Don Bracken present.
Yes, thank you. There are no applications for permits or expansion or anything. This is just a property that had a failed system that didn't meet the 6-foot separation. So, the proposal includes a new leaching trench at a higher elevation to get the separation and the installation of a fast denitrification system. We meet all Title V setbacks. We try to place it in a location to maximize separation to wells. But because of the density of the wells in the area, you can see there are several wells that we fall within 150 feet of, but not within 100 feet of. Obviously, it's a small lot, just over 10,000 square feet. We can't meet the 50-foot property line setbacks either from 3 of the lot lines. The property currently has a well, but with this maximum feasible compliance, they are going to hook up to town water. So we see it as an overall benefit.
Any questions for Don?
Straightforward.
Okay, can I get a motion to accept the variances needed for 2 Tennessee Ave?
So moved.
Second.
Favored by roll call vote, Malcolm McNabb,
Yes.
Jim Cooper,
Yes.
Meredith Lepre,
Yes.
and Steve Visco says yes.
Hey, thank you.
Thanks, Don.
Good night.
Okay, appeal of housing violation for 21B Tacoma Way, map 67, parcel 162.
Correct. So this is an appeal of a housing violation. We've been dealing with this violation for a while. Kathy is here to provide specifics. Ryan was the owner of the property, was issued a panelist link and last month as well as this month, and he hasn't shown up to either of the two. So I say we move forward. Kathy, would you mind giving specifics?
Sure. This was a housing complaint that we received last October 2020. And of course, it was during the height of COVID. And the folks that complained were nervous about overcrowding at the property, as well as high gathering numbers and folks not wearing masks. And at that time, they were supposed to wear masks outside, even if you had, a barbecue or whatever. So we went and did a inspection of the property and found many violations. Screens were missing on doors and windows. Smoke detectors weren't working. This was a duplex. It's a little ranch house, but it has a basement apartment. So there were smokes missing in both apartments. There was a hole in a bedroom ceiling. There was trash around the yard blocking egress as well as in the driveway. We found rodent burrows and, things of that nature. So we worked with the owner, Mr. Conway, and he did correct most of them over the next couple of months, October and November. And I did issue him a ticket because we came back and there were still many violations. So he got a $300 ticket. He asked if he could appeal the ticket, and he still hadn't put the screens on the doors or the windows. So at that time, which was November of 2020, I asked him to order the screens in November and have them installed by next April 15th, 2021. And he said he would do that. And I said, if he did it at that time, I would waive the fine or not object to it in court. We came back in April, still no screens. Several inspections later, May, July, August, and actually as of yesterday, he still is missing 6 screens and 3 door screens, 6 window screens. And actually during another one of my inspections in July, I found trash blocking the egress of the basement apartment. And he also blocked some egress on his egress window wells. So he was issued a $200 ticket at that time, which was July of 2021. So as I said, as of yesterday, looks like he's working towards it, but he still was missing 9 screens. So at this point, I am not inclined to give him any leniency or, offer waiving of the tickets because he still, a year later, hasn't complied. He will argue COVID and pandemic shortages, but I've dealt with several homeowners lately that have gotten screens on windows and doors within 4 to 6 weeks. And, he's going on 12 months. So, that's basically it, in a nutshell for that property.
Anybody have any questions for Kathy or? What's the board's take? Can I get a motion to keep the fines in place?
Motion to keep the fines in place.
I second that.
Okay, all in favor by roll call vote? Malcolm McNabb,
Yes.
Meredith Lepre,
Yes.
Jim Cooper,
Yes.
and Steve Visco says yes. Thanks, Kathy.
Thank you, Mr. Chair. Thank you, board members.
Okay. COVID emergency discussion.
Absolutely. So we'll be having this discussion every month until COVID gets at least in some way under control. So there is good news. We haven't seen the bio-bot, so I don't know how we're looking for next week now that schools have been open for about 10 days. However, the good news is that our caseload has dropped significantly. The mask orders are working. They're working very well. So we have dropped out of the highest risk category in the whole, we're the only county in the entire state of Massachusetts that is not in what's considered the red zone of high transmission, but we are still under the yellow zone of substantial transmission. And CDC still is recommending that we maintain a indoor mask order, an indoor mask order. So I would suggest that we follow that. What I am also wondering if the board is still interested in discussing is whether or not if a group such as a performance venue or a gym, if they start asking for vaccine cards at the front, at the door, just like the bar, would they be still required to wear masks? So far, the answer is yes. All masks are still required indoors, but I wanted to see what the board's thoughts were on if we would be okay with that, just as the incentive.
I would be okay with that. I don't know about the rest of the board. I'd like to hear some discussion before I get definitive.
Is this to say, so at gyms, they wouldn't have to wear masks? Sorry.
If they show proof of vaccination as they enter, proof of vaccination, just like what the Chicken Box, Gaslight, and the brewery did, but they still require masks because we still require masks.
Yeah.
Sorry, I almost jumped the gun on that one.
I mean, it
Roberta,
seems-
I'm sorry, go ahead.
Go ahead, Meredith.
It seems like that would be carving out our mask order a little, which we've discussed in last meeting. We did not want to do because I just get concerned that that would sort of, everybody would get an excuse.
Absolutely, I'm totally fine keeping it blanket.
Jim?
Roberta, would that mean actually having the physical card with them? Or could people take a picture of that card and keep the picture in their wallet and just show the picture in their phone to let them in? Or would you need the physical card for someone at the door to look at?
Yes, this actually, it's a very good question. So thank you. Some of the concert venues off island, what they're starting to do is you can take a picture of your card, but you also need to show an ID that matches the name on that picture. So it's just kind of like a two identification method, a two-factor authentication. But that's what they're doing off island, and that would be the best way to do it. But I am, just like I said, I'm okay with keeping the blanket requirement as well. It's the easiest way.
Mr. Chair, I could flip a coin on this one, actually. I could flip a coin.
Yeah, I kind of feel the same way, but I would say I'm more leaning towards the blanket and following what the CDC and your recommendations are. And, you know, we're doing good now. It's working. We gotta, you know, especially keeping the kids safe. I think we may need to wait a little bit longer.
Sounds good to me.
I agree with that, Steve.
Okay. Meredith? Oh, sorry.
Well, and it's, I think, a little bit unfair for us to say that the adults who are vaccinated can take their masks off if they're indoors when the students in the high school and middle school who are vaccinated can't take their masks off until maybe October 1st, maybe. And that's still a maybe. And that was, I think, if only 80% of the school is vaccinated. So I just feel like that's a little unfair for us to say when we're making our kids wear masks.
Sounds good.
Yeah, I think it's trying to do the card thing, and how are you going to police that? And
All right. Mr. Chair, I'll stop flipping the coin and I'll go with the consensus of the group, at least for another month.
we need to, you want a motion to keep that in place, or are we good?
No, we can
In
make
place.
consensus. because it stays in place. We're not changing anything.
Yeah.
So we can maintain it for another month by consensus.
Okay, yeah.
I think so. Last update on it is to move on. The last update on it is we are hearing the FDA acceptance of a dose for children ages 5 or older has still been pushed back another few weeks. They still haven't approved it. So as soon as we hear it, we'll be rolling it out. The vaccination clinics are still going Thursdays and Sundays. Thursdays from 4:30 to 6:30 and Sundays from noon to 2. But we will probably be combining that to once a week as demand has kind of dropped. And then as we move forward, I think it's really important for us to kind of push the information out there that this is going to be very much like the flu, where it's endemic to the world. It's a pandemic, but it's going to be endemic to parts of the United States as well. So we're gonna see flare-ups, and we're gonna see mutations just like the flu. So we're already monitoring the Lambda and the Mu variant, and there's murmuring of an Omega variant already in the literature. So we're just monitoring it, and it's one of those things that we're just gonna have to learn that once the vaccines are fully out there and fully rolled out for children all the way through adults, and we reach a critical threshold, we will probably have to, we'll probably look into lifting the mask orders at that point, and just looking at the seasonality of COVID and flu moving forward. That's probably looking into March, possibly, when we've reached a level of full herd immunity in the state of Massachusetts. We'll probably never reach it for the United States, but we'll get to that cyclical pattern that we've been seeing with flu. And this year the hospital is already has scheduled some flu clinics. We're looking to get a hold of our own flu vaccines as well. This is going to be a really tough flu year if we don't pay attention. So we need to get ahead of it, get your flu vaccine, because the last thing you need is a co-infection from flu and COVID. That is a lethal combination. So please, once the flu vaccines become available, please get your flu vaccine for this season as well. And with that.
Yeah, Mr. Chair, I'd just like to emphasize what Roberta just said about the flu. Most experts are actually predicting quite a resurgence of flu this year for a lot of reasons I'm not going to get into. And I think we must protect against that. And the other thing I want to make sure the public understands is I've had a lot of questions about the third shot, and the FDA is presently not recommending that for most people, although there is an advisory meeting tomorrow, which maybe clarifies some of the uncertainty and controversy around the subject of a third shot.
Does anybody else have any questions for Roberto or anything?
I'd like to bring up something that Crowley talked about at the last meeting he was here. And it's about us granting variances to people that cannot get the space they need between their well and their septic system. And it goes back to people that couldn't afford to put in one of these alternate septic systems. The health department went to the state, and the state gave us some money that we could loan to those people at low interest rates over 20 years to help them do that. And my question is, because we grant these variances because they can't get the distance from the well to the septic system, I was wondering why Roberto can't talk to the water company, and maybe some of the reason is because we think that the people think it's cost too much to tie into town water. And maybe there's a way that Roberto can work with the water company, that maybe the water company could let the $5,000 or $6,000 or $7 fee that they charge be spread out. I believe that right now, someone mentioned they spread that out for maybe 2 or 3 years. And I think if we could get a system like that, we wouldn't have to grant so many variances, because I think a lot more people would probably end up tying into town water.
No, absolutely. It's definitely a conversation we've been having, because a lot of these variances would go away if more people were tied to town water. One of the big things that we're starting to see come down the line is actually as DEP is going out taking some of these PFAS water tests around the island. I received a letter this morning about, oh, there's my light. I received an email this morning about how there was a PFAS contaminated well above the maximum contaminant level just off of Hummock Pond, which is nowhere near the airport. So we're probably going to start seeing PFAS showing up around the island as we start looking for it. And it might be worth having a discussion. I'll have my discussions with the water department with Mark, but it might be worth having a discussion possibly to look into getting a regulation requiring town water connection. If we were going to start seeing groundwater contamination of this level, we really need to start moving forward with it. I know there's an expansion for the area by the airport already planned. The airport is paying for one section, but the town and the water department is going to just do the whole area over by Monahansit, Evergreen, that neighborhood. But right now, in my opinion, if you have access to town water, I would suggest looking into connection and start abandoning the wells just to be safer. It's not a permanent solution. I mean, it is a permanent solution. It's not the best solution. We would love to be able to remove PFAS from the groundwater, but until we get a solution to do that, connecting to town water is the best bet. I absolutely agree with what Mr. Cooper is talking about here. We should look into forcing connection.
Yeah, and I think, to one of Jimmy's points, he's trying to point out we're separate departments, and we secure the money each year or every other year after it runs out. And I'm not sure if the water company actually has a program like that. And you're right, Jim, it is expensive, and it's one of the biggest things I even hear from my clients when it comes to hooking to town water is the initial costs. And if there was some way that the water company could have a program similar to ours where they could, have a low interest loan to take care of that would probably help out a lot of people. Meredith?
Absolutely, I'll talk to
It's my understanding, and maybe I don't know because I don't know a lot about this, but that you have to pay for somebody to hook you up to town water, and then the water company charges you sort of a fee for the privilege of being able to hook up to the water.
That's right.
So it's the privilege fee that like I think given the current PFAS situation, they should think about either, the town is going to have to pay that for all of the houses in the Mattoxam Valley and by the airport that they're hooking those people up to water. So it seems like it would be the right thing for them to do, to either give out loans or waive that fee for people when there's PFAS in their water.
Yes, I think that would be the case anyways with that specific region and situations, but we're talking about just not places where they found PFAS now, but anybody who has access to water and they're going to upgrade their septic and they have to get on water, abandon their well. The costs are very significant, even before you scratch a piece of dirt. So it is something that, if that was out there like we have at the Board of Health, that would help a lot of people. Any other questions for Roberta, or does anybody else have any other comments? I guess seeing none. Everybody's content. I guess we need a motion to adjourn then.
I'll
So
make a-
moved.
This is the shortest meeting we've had in a long time.
Well, there's really not much. There wasn't much on there.
No,
It's very rare that it's like this.
Yeah. Yeah, you got a second?
Yeah, Kathy Flynn. Oh, sorry, I have
Oh,
to.
did-
Yeah, let me introduce our newest
Yeah.
inspector, Kathy Flynn.
Hi.
So we stole Kathy Flynn from the HDC. She started 2 weeks ago now, I believe, 3 weeks ago now, and we're looking forward to spinning her up and getting her out onto the field as soon as possible. So Kathy, don't get used to these meetings being this short.
Yeah.
Yeah, I'm not used to short meetings.
Well, thanks. We're glad to have you, Kathy.
Thank you.
For Kathy, anything less than 5 hours is a short meeting.
so do you need a motion to adjourn?
Yeah.
Well, I make that motion.
Second,
Okay. All in favor by roll call vote. Malcolm McNabb,
Yes.
Jim Cooper,
Yes.
Meredith Leopard,
yes.
and Steve Visco says yes. Okay, thanks for coming,
All
everybody.
right, thank you. Well, thank everybody.
Until
Find
next
something
month.
to do for the next 2 hours.
Take care, everyone.
Sure, I'm sure you could go back out to work.
Yeah, there you go. All right, take care.